I thank Sheila. It is 9:30, March 16th, 2026. It's just come out of our County Board of Commissioners meeting, and I will call a Flores County Board of Health meeting to order. And looking at the agenda, does the board have any recommended additions or deletions to the agenda?
I don't have any.
Make a motion to approve the agenda as circulated.
Second.
Motion and a second to approve the agenda circulated. All in favor?
Yes. Yes.
This as well. And I don't believe we have any expenditures. Yes. And our minutes, we do have March 2nd, 2026 Board of Health meeting minutes. Any questions with the minutes that you guys have seen?
No, I don't have any. I make a motion, we approve the March 2nd, 2026 Board of Health meeting minutes as submitted.
A motion from Commissioner Elman to approve the March 2nd, 2026 Board of Health meeting minutes as submitted.
I'll second that motion.
And second, all in favor?
Yes.
Yes, as well. We will limit our public comment to 5 minutes per speaker. And moving into our 9:35 Public Health Director new hire, to have one letter of interest from.
How many times do you have to do this? I don't know. That's so bad. Like, I don't know, third time's a charm, fourth, so.
From Julie Cavalier, Dolores County Public Health Administrator. And just an update with where we're at with Montezuma County. Dennis reached out to Montezuma County's legal and reworking the IGA to carve out everything really except the immunization leaves, which they've been doing for us for about a year now, a little less than, or a little less than a year. And apologize, wasn't here last week. Did you guys have anything?
No.
Okay.
Nothing exciting.
All right. Did you guys have a chance to review the letter? I know you looked at it this morning.
Yeah.
Okay, perfect. I'll make a motion to hire Julie Bible as Public Health Director, Dolores County Public Health Director.
I'll second the motion.
Any other discussion?
None for me.
All in favor?
Yes. Yes.
Yes as well.
Thank you.
All right.
Now they'll be coming back with another letter.
I will print another letter. We have to rehire every year.
No, so
Okay.
No, we do not.
Yeah, and then we'll keep apprised with that IGA and obviously be carved out. See what they're doing on
I had a question.
Nope.
So I understand that the salary range was advertised. Did you guys decide a starting salary for Ms. Keibel?
You,
Advertisement?
45 to 51,750. That's the range.
Good, how are you?
What? For itself to pull up, that range was set, I can't remember the exact, grade level up, was it 7? Okay. Grade 7, step 1 would be 45, grade 7, step 10, 51,750. $750 flat increase between steps. Looking at a new format for a salary schedule. Still a lot to work out with it, but I think moving into this will be in the best interest, I think. Right now, before we fully try and roll something out and get some bugs worked out with it, but yeah. Yeah, 45, and then 45, 750, 46, 500, 17, 48. So I think looking at other counties and really comparing positions to grade levels, I think the grade level fits pretty well. I just don't think the discussion would be where on that grade level, which STEM. So
So are we telling her today how much we're paying her?
yeah, I'm probably seeing right now.
I think that'd be good.
Yeah. Yeah.
You could be doing it free.
And then with this, with the step increase, the 600 and 600 come back into effect.
Yes.
Okay. What do you guys think?
Give us a number.
Oh, I mean, 45 for step 1, 45, 750 for step 2, 46, 5 for step 3.
What were you making now? I was at 45 when I became the admin.
And you haven't hit the 6 months for that first, that initial step increase. And I mean, I haven't got it worked out with how those steps are how people are gonna move up that step schedule, but the biggest downside of it, I mean, this one downside is that when you hit step 10, that is what the max is gonna be. Unless the entire schedule is gonna change through cost of living and just bump everything up all at once. I mean,
I thought we decided on that. This is where it's at here, right?
yeah, so
And then the director position. I thought that was what we decided.
okay, that's step 4.
Uh-huh.
Um,
That seemed, I don't know, was it step 4? Yeah, I know, you guys didn't.
Didn't step 4. I mean, like with experience coming in, and I mean, this is listed here as administrator without the medical, I would be director without medical, which would take on more duties as director. Medical. Grade 7, step 4, 47,250.
Yeah, I'm sure, but because we discussed it though. I wrote it down, that's not like it.
Make a motion to set public health, Dorothy Public Health Director's salary at $47,250. Which would come into a grade 7, step 4. Motion a second, all in favor?
Yes.
I'm a yes as well.
I mean. I just want to remind you guys that we took 25,000 out. For environmental health, so we're not charging you guys for that. So, I mean, I just think that they're.
And the other is not included in that either.
No. That, and I just think that's something you need to really think about, because I'm still doing environmental health and I'm still doing the director. And there will be a pretty good increase in meeting time, because now I have to do all the director meetings. And then I have to, the first thing I have to get done now is the survey for George County Public Health, that of what we're gonna work on for the upcoming year, so, I mean, there will be some changes, I was gonna ask if you just do halfway, but I don't feel like,
So halfway, I mean, it'd be another 750 of 48. 6 months. Should be at 47,950.
This was some too that. The first CDPH I went to up 20 House Bill, it's another B26-104. That in July, they're requiring water testing quality for all mobile home parks. So it was a big hoopla, because they said there's already water testing through your municipality.
right,
It goes, so why through mobile home parks? And something about the owners of the mobile home parks have to eat part of that cost of the testing. But it's a bill that starts in July, which why a mobile home park, not just your house, I don't worry about.
probably because of they service several different.
Yeah. Yeah, it was one of them, they talk about these bills as a solution looking for a problem.
Yeah. So. Is there a go with that, Julie? What was it now?
47,250.
And then 6 in 6 months?
Yeah, 6 months.
6 in a year.
And then 6 in a year, so 12 in a year. Yeah. Anything else, Board of Health? Make the motion to adjourn.
Dennis,
Oh.
anything?
No, yeah, thanks for hanging in there, Ms. Kybel, in this process, and thanks to the board for yeah, working this out, and we'll see what Montezuma County comes back with. You know, they did have a certain amount of money into the last proposed IGA for the vaccination program as well. And realizing that they're keeping the proceeds from that program. But we might see a small request included in their IGA for that, but we should be getting rid of the vast majority of that $20,000 consulting amount.
Anticipate that the travel is going to stay in, but it was maybe, I think, $400 for the year.
Yeah.
So it was.
And then we still have that grant too, that I wrote that covers the travel and covers the time. So,
Which really, I mean, we shouldn't be out of pocket.
and then
Montezuma County at this point.
today was the deadline for our BOCC program, so it's gonna stay with Montezuma County.
Yeah.
For now, so, and that won't be any harm to us anyways.
Be better for the operation overall.
Well,
And be running
because
that.
there's nothing in the fridge, so it's kind of silly.
And the liability would stay with them.
Yeah.
As the operators.
Quick, is it gone back to Montezuma County?
No, it's still through La Plata, which I don't know. I mean, we've had some issues there,
Well,
but we're working through it. It's not a bad thing. We finally got everybody on the same page as far as reimbursements and working with that. I don't know I don't know what it would. I don't know if we should just move to Montezuma County or leave it like it is. Cause regionally, it is La Plata.
Oh, is it?
Mhm.
Can I chime in?
Yeah.
Sure.
So Julie, it's my understanding that what we have in place currently, and just so the board is aware, we have WIC. The majority of the WIC work is through our county. However, we did not have a qualified director to handle the high risk clients.
Yeah,
And so the high risk clients, the IGA with La Plata County focuses on the high risk only. Is that correct, Julie?
yeah, that's
Maybe
correct.
maybe you could describe how that works to the board.
Okay, so, there's a lady in La Plata County, Jenny Pritchard, that's over Raquel. And just helps her, they meet, I think, twice a month now, and they just go over cases. We have not had, that I'm aware of, a high-risk case since I started being the director. So, I mean, it's more or less just kind of like, I guess you would just say a mentor program. They just make sure and just make sure that if we ever have one of those, they can help her. But I mean, that's basically all it is they're there in case we get a high risk case, Dennis.
Yeah, and that's mandated by statute because
Right.
we didn't have anyone in the county that was, even when Tracy was here, we didn't have anyone in the county that could handle high risk cases. So so we had to IGA with someone. And just as a reminder to the board, there were plenty of warnings, I would say, from the state that they were thinking about pulling the entire WIC program
True.
up to Boulder or Denver or wherever they do their magic. And they really indicated to me in a conference call that it was only a matter of time before the entire WIC program was going to be taken out of the hands of the counties. They felt like the counseling and everything else to the moms or future moms could be handled via Zoom. And so I wouldn't be surprised if at some point we see that taken away.
Yeah, but that, I don't know, it just takes away from the local.
Of course.
Coming in and being able to have help right away. I mean, we even got that maternity room up and running, so that's been a big help to young mothers and here, all those classes have been covered. I know that the last couple of ratings that we've got, we've been at 100%. Our audits have all checked out, so we're good there. So that should help us if they do the state talk again about. If it's, I think it's very necessary though, but.
And I don't think we're paying La Plata County, but I do believe they're getting a portion of the WIC money from the state. Is that correct, Julie?
Correct, yes.
Okay.
It's
And-
very cool.
Yeah, and at one point, we sort of had to fight to keep any portion of the WIC program in Dolores County. It seemed like the state really wanted us to give it up and give it to Montezuma and we pushed back really hard on that just to keep that local presence. So it was a little bit of a fight. I just want the board to know.
Well, and you need to remember too, that at that point in time, the numbers were very small. And now they're well over, we're pushing right up to 75 clients now. Where before they were in the 20s, so I think that that has been a huge improvement. The reaching out and the contacting people and the doing the appointments, you know. That's, I commend Raquel for what she's done with that. So, but I think that helps us too, Dennis, because our numbers were extremely small.
Yeah, and I can tell you, let me just, if the board's interested in hearing this, I'm looking at the service order that we have with La Plata County, and it's got quite a bit. Let's see, there's a monthly contact with the WIC educator, schedule part-time dietitian, virtual check-ins with Dolores staff quarterly, nutrition education follow-up, biannually, Compass secure access forms, yearly, 2 trainings a year, in-person visits 1 time annually optional, fiscal compliance assistance, nutrition education plan support, every other year, state monitor visit lead, and then continuous, they've got just communicate policy changes, partnership with agencies, directors, ensure compliance, outreach materials, file retention documentation, provide feedback to the local agency as needed. And then there's also WIC registered dietitian, sort of the same kind of thing. So it's actually, it's probably okay. Julie, do we need to look at renewing that? Do you know, maybe once you get settled in and put your big hat on, you could take a look at that IGA and give me a call if you think
I can do that.
it needs to be renewed or something.
I was trying to remember what that was.
Yeah, I'm looking at it. Let me just look real quick. Yeah, I don't know why I'm asking you to do it. I've got it open right now. Sorry. It looks like it expires next year, June.
Okay,
So maybe put that on your calendar to talk about renewal beginning of next year.
all right.
Great. That's all I had.
Alrighty. Perfect. I think there's a motion to adjourn. Second, all in favor of adjourning?
Yes.
Yes, as well. Something that's gonna be a bigger challenge is depending on what happens to social services, I'm afraid we're gonna move to regionalization of two and the state's.